Good afternoon, everyone. Thank you so much for having me. And congratulations to all the nurses. Happy Nurses Week. All protocols observed. My name is Dr. Anireto Chika. Really love my presentations to be really practical. It's all about stress management, basically. So I don't want to just talk theory. There will come a time when I'll have you, get comfortable. If you want to sit on the floor, if you want to sit on the table, sit and be able to, practice what I'm teaching. So until we get to that time, you can go up, you can walk around, you can leave as you like. But before that section, I will let us know when we should, stay one place and actually focus, because that's what we're all here for. We want to learn how to handle stress, and we all go through stress. Thank you so much. So I'm going to start like this. The point of this presentation is to help us understand what we mean when we talk about stress. So we use that word a lot. Oh, I'm stressed. This work is stressful. I'm so stressed. What a stressful day. I want us to really understand what it really means when we say stress. Secondly, I'm hoping we'll also understand what predisposes us to stress. We might be surprised at, some of the things I'll say, that sometimes your very personality, the way you are, predisposes you to stress. And that is why we'll be doing what we'll be doing. So we all know the external sources of stress, but what about the internal sources of stress? Then we'll talk about the consequences, some of which will further compound the stress itself. And finally, most importantly, we'll learn how to handle our own individual stress. And that's when we'll do all the, get comfortable, no one leaves, no one comes in, so that we can all be focused. All right, so I'll be using this outline. I'll start by explaining what work-related stress is. I'll tell us what predisposes us to stress, the symptoms, and the red flags. And then finally, we'll talk about consequences and how to handle it. So there are different ways to handle it. We will learn about that as we go on. So what is work-related stress? Just hearing the word stress, what emotion does it evoke to hear this word stress? It makes people feel uncomfortable, unable, incompetent, anxious, not good enough, stretched, small, tense. All of these are not pleasant emotions. They're not pleasant sensations. But these are all the emotions that are evoked when we talk about stress. So stress, especially the work-related kind, according to the World Health Organization in 2020, it's the response people have when they're presented with work demands and pressures that are not matched with their knowledge and abilities and challenge their ability to cope. So that's the WHO definition of what work-related stress is. Eventually, I'll go on to explain what we mean by stress, because you can carry stress from home and bring it to work, in addition to the one that comes from work. And later, we'll talk about what happens when we are chronically under this kind of stress. So you can see the scale here. So the scale is unbalanced. So the key term here is mismatched. There's a mismatch between knowledge and abilities versus the challenge facing you. So the challenge is more than you feel that you can handle. So I've written in black, perception, because I'm a therapist. That's where we come in, the perception. So what this means is that it may well be within your capacity to handle. You just don't feel like you can handle it. And if you don't feel like you can handle it, you actually will not be able to handle it. So therapists, just a sneak peek, therapists like me, we usually deal with the perception, what you think. Because what you think is your reality. Whether in actual case it's real or not is another matter. So it's a perception. When you perceive that the challenges you face at work is more than your ability or your knowledge to handle, that is stress. That is work-related stress. So stress is also this discrepancy we feel when there is an imbalance between what is demanded of us and our ability to perform, especially when there are important consequences that will follow when we cannot meet up. So that is what we're talking about. That's what we're going to be talking about today, how to deal with this kind of response when what you have in front of you, the demands, the challenges, whether at work. Now, I know the title is work-related, but I'm going to keep venturing into family because I know in reality this is what happens. So when you feel that way, when what you're faced with is above your perceived capacity to deal, that is what we're talking about. That is the stress. So there are two major types. It could be acute or chronic. Now, this is important because it might surprise you to know that stress by itself is not bad. You know, when I started by saying, what does this word evoke? Very negative feelings, very negative emotions. But it will surprise you to know that stress by itself is not bad. It's neither bad nor good. It depends on how you see it. It depends on your perception. When you perceive it to be that I cannot cope, I am not good enough, I'm not able, I'm incompetent, that is bad. And when it goes on for a long time, then it's chronic, and then we talk about the consequences. So acute stress by itself, let's say less than 3 months, is actually a normal physiologic response to challenges. It's the way the body helps us to deal. For instance, imagine when you have an exam. You have an exam in 2 weeks' time, and it's like a board exam, or it's a major exam. It's going to determine your career or that promotion you've been wanting. And if you fail, you don't get it. If you fail, you remain stagnant. If you pass, a lot of opportunities. So when the body rises up to the challenge, braces itself, you know, your memory is almost like, you know, your memory becomes sharper. Your vision is sharper. You're so focused. That is acute stress, and it's helpful because it helps you to deal. Now imagine again if you go on a safari somewhere, maybe South Africa, and somehow there's a wild lion that is loose, and then you have to pick to your heels. So that's quick response, fight, flight, or freeze, that is stress, and that is good, it's helpful in the acute or the short term. So what I'm talking about really, when I talk about how to handle work-related stress, I'm talking about the chronic kind, the kind that goes on for months and months, for 3 months or longer. That is acute, that is chronic stress, and that is harmful. So this is the stress response. So you see, it all starts with our amygdala. Interestingly, this is the part of the brain that handles perceptions, emotions, how we feel, fear, the fear response. So the amygdala gives a signal to the hypothalamus, which sends a hormone called the corticotrophin-releasing hormone to the pituitary gland, which now releases another hormone called ACTH, which, you know, sends signals to the adrenal glands, which are on top of our kidneys, that tell them to release the catecholamines, the adrenalines that get us, our hearts beating fast, get our eyes dilated and ready to take in everything we need to take in about our environment, get all the blood supply to our muscles and away from our stomach so that we can run. This is what happens when we're stressed. So in the acute, you know, when it happens acutely, it's normal, it's physiological, even helpful. The problem comes when it happens for a long time. So imagine the chronic stress of an ill child, maybe a special needs child, maybe a child that had sickle cell. Imagine the chronic stress of a dysfunctional relationship. Now bringing it to work. Now imagine the chronic stress of being at work, being put in a role that you don't feel capable of handling, or being, you know, put with team members that you feel you don't get along with chronically, or having a boss that you feel is demeaning, belittles you, micromanages you, and doesn't allow you to take initiative. And it's been like that for years. So that is what we're talking about. Now, that kind of stress is harmful. So everyone actually experiences stress. But today's, you know, we're talking about nurses here. Is it worldwide? Do all nurses experience stress? Is it only Nigerian nurses that experience stress? Do they experience stress at all, or they don't? So according to a survey that was carried out in the United States, in North Dakota, this is in 2018, they found out that over 90% of nurses experienced burnout, like they felt like they couldn't take it anymore. Conversely, in Nigeria, University of Nnamdi Azikiwe University in Awka, Anambra State, when they surveyed 226 nurses. Around the same time, 2019, they also found out that 98% of them experienced some kind of stress. So nurses everywhere, not only here in Nigeria, out of the country where a lot of us are running to, are stressed. In fact, everyone experiences stress, including children. They just show it in different ways. So stress is universal, unfortunately. So what predisposes us to stress? External factors and extrinsic factors. Over time, when you continually work longer than you probably should, understaffing, low job satisfaction, when your job doesn't fulfill or satisfy you, a heavy workload, a lot of people are not coming to work, so it falls on your shoulders, especially if you're a manager. Poor work-life balance, we'll be talking about that later. Having to provide care to critically ill patients, high, intensive care unit workers, people in emergency, people in the HCU, constantly working night shifts. I think we all know these factors. But what about the intrinsic factors? Is it possible that your very self, could be the source of some of the stress you feel? Absolutely. So there are different personality types, different cognitive styles that predispose one person to stress in the same environment and the other person is not. So personality is the way we are. So we inherit some of our personality, genetics. Some of them we learn by watching our parents. Behavior is modeled and we imbibe some of the things our parents do, some of the ways our parents cope. There are two general types of personalities, however, the type A and the type B. So type A personality types are people who are high achievers. They're actually people that are almost put on a pedestal by people in the work class, in the working class. So type A personalities are the go-getters, they're the high achievers. But on the downside, they're the ones who don't celebrate little wins because they're always ready to go on to the next win. And they're the ones that are continuously competing because they need to reach some goal and it never quite seems to be enough. So I'm highlighting the pros and the cons of different personality types that would predispose them to stress. So you can imagine if you're one of those high achievers, you're the go-getter, you strive, you compete, you're extremely competitive, you don't really celebrate the wins because there's no time you have to achieve, you have to meet goals and targets and deadlines. So what happens is that you don't celebrate little wins, and everything seems like a goal to be met. You are not smelling the roses. You're not taking time to enjoy life. You're not taking it easy. And that personality by itself predisposes you to stress because of the way you see things. You see things as, you come to a meeting and you're looking at those to network with. You're not looking at people to chat with and relax with. You're thinking of people to progress, to enhance your business. So that kind of mindset is great for the business world, but it's harmful over time to the person who acts that way. Then type B personality types are the ones that take it easy, it's all about relaxing, it's all about smelling the roses and drinking the coffee. On the downside though, they're also the ones that are not having a lot of drive, initiative, they're the ones that procrastinate a lot. So when you do this and then your workload piles up, you by yourself have predispose yourself to stress. So it's about knowing where you fall and strengthening your strengths and, reducing your weaknesses. No one is perfect. But I wanted to highlight the factors that are intrinsic to us that predispose us to stress, regardless of what happens outside. Cognitive style, what I mean by that is core beliefs. If you've ever listened to me talk, you've probably heard this over and over again. So a core belief is the basic way we see ourselves and other people. So if you see yourself as competent, independent, no matter what happens, I can cope, you realize that though the work comes at you and the workload increases, you already see yourself like, I've got this, I'm good, I know what I have, I know I will be able to cope. So already you are a pedestal above someone who may not have this kind of cognitive style. Now, on the other hand, supposing you always had this vulnerability, you've always feared that you were not good enough, or that you were not as good as you thought you were, and maybe something has happened in your place of work that has revealed your vulnerability. So when something happens, when a challenge presents itself, already you're looking at yourself and saying, can I handle this? Can I meet up? Will I disappoint my people? Will I disappoint myself? And already you're sabotaging yourself, and already you're feeling stressed. Remember our definition of stress. When you feel like, when you think that what lies ahead of you is more than your ability to handle, that is stress. So stress is not the workload. Stress is not the absent co-worker. Stress is how you see it, and you've judged it to be above your ability to handle. That is stress. So you see that it doesn't necessarily depend on the external factors now, because two people are faced with the same workload. One is stressed, the other not so much, because of what I'm talking about, perception. So the second intrinsic factor is unhelpful core beliefs. External versus internal locus of control. So what that means is, to have an external locus of control is to feel like the things going on in your life are not within your control, that they are controlled by something else. A lot of times people point at, this is a family generational curse thing. I've always known it happened to my uncle, happened to my cousin, and it's my turn now. People in my family, when they get to a certain age, when they get to a certain level in life, they begin to depreciate. That is external locus of control, when you feel like there's nothing you can do. And interestingly, in my clinic, I see people, with this, way of thinking, and they've learned to be helpless because it's beyond their control. What can I do? This spiritual realm is beyond me. I don't know. So they go to their imams, they go to their pastors to seek help. And unfortunately, they can fall prey to these, some, not so good pastors and imams. But that is what I mean by external control. So when you feel locus of control, when you feel like things happening in your life are not within your power, they are being manipulated by, something external beyond you, that in itself is a predisposing factor to stress. But the internal locus control is more like a protective factor, when you feel like, I've got this, it will go my way, I've got this, and I'm on top of this. Another intrinsic factor is unhelpful coping strategies and behavior. There's some people who, just from learning from parents or people they look up to, the way they react to situations is to flare up, to shout, to begin to, demonstrate and all that. And can imagine that happening in a work environment. It compounds things, and even if you were right, that behavior is not acceptable in a work environment, let alone for a nurse. So that kind of thing, it's a coping strategy, but it has served to compound the individual's problems. Some other people cope by making unhelpful friendships. Maybe family dysfunction, and then your co-worker, your fellow nurse, or your superior has a listening ear, very compassionate, very kind, and before you know it, you formed a stronger emotional bond with this person than with your spouse. And before you know it, things happen and you find yourself in a situation that you didn't dream of. So that was your way of coping with the stress, because you wanted to pour out your heart to someone you felt understood, but it ended up compounding your problems. So we've talked about the predisposing factors. We said they could be extrinsic or extrinsic. Now let's talk about the symptoms. So interestingly, symptoms of stress are biopsychosocial. In other words, they affect our bodies, they affect our minds, they affect our emotions, they affect our social relationships. And this is why we're having this discussion today. So physically, poor sleep, poor appetite, diarrhea, aggravation of pre-existing pain or underlying illness, blood pressure getting higher, meanwhile it was controlled before now, blood sugar getting out of control, recurrent acute illnesses. So if you have a patient, they're always there, their folders are full. They come to hospital every other month. Malaria today, diarrhea tomorrow, chronic acute respiratory tract infection the next day, tonsillitis the next day. It may be some underlying stress, because stress does compromise the immunity and makes the body open to these opportunistic infections. Cognitive means in your mind, the way you think. So interestingly, I mentioned cognitive style. So cognitive styles predispose to stress, and stress worsens or predisposes to poor cognitive styles. So if before you were wrong to think that you were not good enough, maybe you really were good enough, but you didn't think so, the stress itself will come and make you feel like you're not good enough even more. So poor concentration. I have some young people coming to tell me, "Doctor, I don't remember things like I used to." And then when I take a brief history, I realize they are stressed. So it's not dementia, it's stress. Forgetfulness. Irritability, something that you would take in your stride before, all of a sudden you're flared up, you're upset. Stress. So biopsychosocial in nature, the body, the mind, the emotions, the way you behave, all because of stress. And remember, we're talking about chronic stress, in this case, work-related. So I said I was going to tell us about some red flags. These are things that when you see, it should shout at you. You should have a red flag in your mind. Why? Because these are the things that lead to people harming themselves or harming other people. Thank God we've not gotten to that place here in this country. But I'm sure you know that all over the world you hear of young people, old people, getting up one day and carrying guns and shooting their colleagues and shooting innocent people in a mall or in a school. So there are some red flags, and it's, stress, the way they perceive things and what it means to them, and they're just, showing out this behavior, acting out this behavior. So number one, atypical behavior. What this means is what is not typical for that person. When you begin to see it, it's a red flag. And what you ought to do is to get the person help, talk to the person, the listening ear helps, and then try to see if you can help with one of the things we're going to be learning here today. So remember, this is all about how to handle stress. So with what you're going to learn before you leave here, I'm hoping that you'll be able to teach it to people, and if that doesn't work, tell them that there's help, that there are people who they can talk to that'll help them. Low frustration tolerance. What it means is when prior to that time of stress, someone was able to deal with frustrations and things not going their way and expectations not being met, then all of a sudden, little thing goes wrong and they cannot take it. They've lost their patience, they're upset, they're shouting. That is a telltale sign, that is a red flag. Use of maladaptive coping strategies, substance abuse. I know in this family, we've actually lost one of our own because of this. So it's not a joke, it's not something we should sweep under the carpet. You could literally be the last person that person sees. I have experienced it, you don't want to experience it, it's not nice. To walk the same corridors with someone and then you turn around and they say the person took their lives and you were there in front of you and you didn't even know. We should be our brother and sister's keeper. Task-oriented activity that is not goal-oriented, organized, or effective. So we're talking about nurses, right? So imagine you're a peri-op nurse and you're in the theater and the surgeon is asking you for tools and you consistently keep giving the wrong tool every time. But before now, you were someone who was on top of their job, and then all of a sudden, you consistently keep making mistakes that are not typical of you, that are not characteristic of you. That is a telltale sign. You fall asleep on the job, you fall asleep during a meeting, and they all know you to be someone who is on top of their game. That is a red flag. Feeling hopelessness, and that shows in your behavior. You are quick to be aggressive, or you're quick to give up, and you're quick to complain, and you're quick to sigh, and even your appearance is slacking somehow. Red flag. Consequences. I'll be a bit faster now, just because I want to get to the crux of the matter. I want to get to talking about how to handle stress. So work-related stress can have some consequences at the workplace, at the family, the individual. So unfortunately, you may know or may not know, but it's a fact that stress in itself, chronic stress, increases susceptibility to infections and even cancers. It also increases the risk of heart disease and even mental illness, increases the risk of injury, mistakes. Family-related consequences, disconnection from your spouse, your children, neglect of the children, abuse of the children or one another, I mean the spouses, infidelity, a problem child. So there are some families that the dynamics of which is that the family kind of projects all their stress. Now I'm talking about family-related stress, but I said I was going to keep going back and forth because they're all related. And the stress of the family dysfunction is projected on one child. And the child, usually the scapegoat, the black sheep, is the one that the family projects all their problems. So anything goes wrong, oh, it's this kid. And we have a tendency to do that. So when you happen to be, that kid happens to be your patient, realize that this could be stress. Work-related consequences like low productivity, frequent sick-offs, absenteeisms. Finally, we've arrived. How to deal with work-related stress. So the part where I want everyone to pay real attention or close attention is when we talk about deep breathing downwards. But let me talk about the achieving a healthy work-life balance and living a healthy lifestyle. So how do you deal with all I've said? How do you deal with this feeling of not meeting up and feeling like what is before you, your job, is more than you can handle, and the challenges of your job? Maybe you have a difficult patient. Maybe you have a difficult boss. Maybe you don't even like your job. Maybe you're just marking time, waiting to leave this country. How do you deal with that until your breakthrough happens? Number one, achieve a work-life balance. So a lot of us, unfortunately, imagine if your life was like a big room. So your life is like maybe a room, and there are no other compartments. So you have your life and your job. And your job is one corner of the room, but it's not separated from your life. So when there's toxicity in the job, the stress, everywhere feels the impact. There's no compartmentalization. So what that means is anything going on in your job very quickly affects your life, because you don't really have any life apart from your job, really, do you? So that is what we're talking about. So to achieve a balance means to develop the other areas in your life apart from your job. So we all have different facets to our personalities. We all have different dimensions to who we are. Maybe you love to garden. Maybe you love nature. Maybe you love animals. Maybe, you value spirituality, you value God, you value friendship. Whatever other dimensions to your personality apart from your job is what I'm talking about. So I'm saying, when I say compartmentalization, I mean break that box of your life into different compartments that can be closed. So that if one compartment is toxic, like work, for whatever reason, you have so many other compartments that you can live in and have a normal, reasonably normal life without the toxicity of that part, which is your work, evading and permeating into the other areas. So the way to do this is to, first of all, identify those other things that you like to do. Perhaps you like to garden, perhaps you like exercise, perhaps you like friendship and you like to hang out. What are these behaviors? What are these things that you like to do? And then what is your goal in that area? So I had a patient tell me that, I want to be closer to my siblings. So she valued family. I want to be closer to my family than I am already. My goal is to at least have a united family. And she wasn't married. So she was talking about her father, her mother, her siblings. So identify the area, identify your goals, and identify the behaviors that you need to do or take, the steps you need to take that would keep moving you closer and closer to achieving these goals. So for instance, let's say I value family, and I don't feel so close to my parents or my husband or my children. So my goal could be spend more time with them. And it doesn't have to be anything major. I could spend 10 minutes extra. So you remember we're talking about how to handle work-related stress. So my work is stressful. I feel unable to deal with the stresses in my job. So I identify this other part of me that I need to develop. I write down a goal. And then I write down behaviors, what I would do that would help me to bring this to fruition, to bring this, my goal, to fruition. So I say, okay, I can spend 15 more minutes with my husband, I can spend 10 more minutes with my children, I can maybe weekends, I work weekends, okay. The weekends I don't work, I can spend, go out with my family. So that is what I mean by compartmentalization. And in this way, you will build up other areas of your life apart from this job. And you wouldn't feel the impact of your stressful job as much as you could have. because you have different compartments of your life apart from your work. So spirituality, friendships, fun and adventure, volunteerism, all these aspects satisfy something within us. So to make goals and achieve these things are what is the way to achieve a work-life balance. Healthy lifestyle. I'm going to be a bit faster now just because I want to get to the place where I'm trying to get to. Exercise. So ideally, if you're not overweight, we all need at least 30 minutes of exercise every day. Most days, 4 to 5 times a week. So exercise doesn't have to be, you don't have to go to the gym. You just need to try and inculcate the different types of exercise. So flexibility, do your stretches, weight, you don't have to go to the gym again. Carry something heavy, carry your Bible, touch your toes. Practice standing on one leg to manage your balance. Strength exercises, core exercises, carry your body weight, lie on your back, lift your leg up. Things like that. Exercise, 30 minutes every day. If you can't make it 30 minutes as a stretch, you can do 15 minutes one time and 15 minutes another time. Just in a whole day, find a way of putting in 30 minutes. And if you can't still find a way to do it while you're doing your normal job, take the staircase, for example. Don't take the lift. If you're so busy, maybe on your night shift or something, and you want to sleep during the day, when you get to work, fit in physical activity in your day-to-day life, work life. Diet. So this plate of mine, I'm trying to demonstrate or show that if you had a plate and you were to divide it into 4, one half will be vegetables and fruits. Another quarter will be carbohydrate. Another quarter will be protein. And there should be milk, especially for females, because of calcium and vitamin D, especially if you're perimenopausal or menopausal. Then drink lots of water. How much is lots of water? Like 2 big Ever bottles in a day. So all this helps to ensure that your physical body is on your side, working with you to deal with this stress. Remember that it also feels the effect of stress. Your whole body feels the effect of stress. So adequate sleep. So the question is typically, how many hours of sleep do we need? And the answer is, there's no such answer. There's no specific number of hours that you need as an adult. Children, however, need many, many hours of sleep. The younger the child is, the more hours of sleep they need. So infants can sleep virtually 12 hours a day. But adults, there's nothing like 8 hours of sleep. It all depends on your personality and your age. The older you get, the less amount of sleep you need. So the question is not how many hours, but how refreshed do you feel at the end of the day? If you wake up, you're not refreshed, then you didn't sleep well, and you probably should sleep more. So it's not in the number of hours, it's in how refreshed you feel, depending on your age. Finally, we have arrived. So this is a time when I want us to get comfortable. We're going to be talking about the practical ways to handle stress. I just want to teach us about deep breathing and visualization. So if you want to sit in another way, this is the time to do it. If you want to sit on the floor, I've been given permission by the management and the organizers. If you want to sit on the floor, if you want to sit somewhere, like I might want to sit, but there's nowhere for me to sit. But if you want to, if you want to stand up, you can stand up. If you want to lie down, you can lie down. What this is all about is to teach us how to breathe. And this is actually research-based, evidence-based, to quickly induce the relaxation response. So one of the ways people feel when they are stressed is anxiety, is to feel scared, to feel, tense. So you have the racing heart, you have the palpitations, you have the feeling on edge, feeling tense, and deep breathing is a way to quickly make yourself relax. So I'm going to walk us through how it's done, and then the next slide, we're all going to practice it. So it's very simple. When you're breathing in, while you're breathing in, count to 4. When you've done that, hold your breath for a count of 7. And after 7, exhale while you're counting to 8. So the counting is done in your mind. You can't count and be breathing at the same time, obviously, so it's in your mind. So you breathe in, and while you're breathing in, you're counting to 4 in your mind, and the counting is slow. And then when you're done breathing in, you hold your breath, like you hold your breath for a count of 7 in your mind, and then you exhale either through your nostrils or through your mouth for a count of 8. So that's the deep breathing. What is visualization? So visualization is something separate, but I like to add it to the breathing because it potentiates the response even more. It brings about the relaxation and makes it more widespread and deeper. So visualization just means imagining yourself, since we're talking about work-related stress, imagining yourself dealing with that issue that you have in a successful way. So it's an exam, it's coping with a stressful boss, it's coping with a difficult patient. It's imagine yourself coming out of that encounter and you're even better than you were going in. So it's all about your imagination. Picture yourself. So I know the question you might have is picturing, imagining, but what about the reality on the ground? The truth is that, we said stress is about how you feel, how you perceive it, what you think. If you consistently imagine yourself doing well and coping, you will do well and cope. That's the truth. And if you consistently imagine yourself failing and not doing well, you will end up not doing well. It's almost like a self-fulfilling prophecy. Why is that though? It's because the way you think affects how you feel and affects your behavior. So if you think you are not good enough, you keep thinking that and you have pictures of yourself failing, you know what will happen? Emotionally, you are demotivated and your behavior will be sluggish. You are not motivated to take action. You are not motivated to reach for it and to keep reaching until your success is achieved. You give up easily and you have brought to fulfillment what you feared. So that is what I'm talking about. I'm not talking about anything. I know there are spiritual bases, but I'm talking about the science of it. So I'm asking you to visualize yourself coping. If you keep visualizing this, so the practice is just to teach you. I'm hoping you'll keep doing this. If you keep visualizing this, it will affect the way you feel about yourself. And when it affects how you feel, your behavior will change. You will no longer give up before it has even started. You will be more tenacious and you are more likely to succeed just because you visualized it. I hope it's a bit clearer now. So for some of the doubters, I know we're scientific people, so we are trained to question, so it's okay. I questioned a lot too. And I was wondering how is this thing going to work, so I understand. So in my slide, I said, imagine a safe place. So you can imagine so many things. You can imagine yourself coping. You can imagine yourself in your safe place. Safe place doesn't have to be a destination. It can be something that, you pull different experiences from your past, what you hope, from your present, that makes you feel safe, that makes you feel content and satisfied. So you can either visualize yourself doing well in whatever it is that you have at hand, that is the source of the stress, or you can imagine yourself safe in the arms of someone you know who loves you, who cares, or who you love, and vice versa. I even like to go spiritual if you're so inclined. Imagine yourself in the failing hands of God. Imagine yourself under the watch, because it's true for those of us who are Christians and Muslims alike. Imagine yourself so protected and so preserved by an awesome God. That's what we're talking about, visualization. So once you understand this, we can now go into the practice. Are there any questions before we go into the practice? Because I really want us all to get it. So if you have a question, please raise up your hand. I'll quickly answer, and then we can go into the practice. No questions? Great. All right. So the lights are already off. So I'd like you to get comfortable. Oh, there's a question. All right. Please go ahead, ma'am.
You said we should compartmentalize our emotions or whatever into compartment. I want to know, by doing that, are you not like shifting, or do I say postponing the doomsday? Let me find it out.
Okay, I hear you. So what you're saying is, ought you not to be working out solving the problem? Oh, great. So I'll answer that question when I get to my slide on mindfulness. Because you're talking about worry now. It's worrisome. How will you escape the issues that you're dealing with? Okay, so we will deal with that in subsequent slides to come. Any other questions? Mostly about deep breathing, visualization? None, okay. All right, so get comfortable. Sit how you want to sit. You can relax Your shoulders up and straight. I'm going to be doing along with you, only I can't sit down. So you can let your shoulders hang and close your eyes. So I'm going to walk us through the breathing. It will be my voice that you will hear. When I say breathe in for a count of 4, I want you to breathe in. If I say hold it for a count of 7, I'm going to count, and then just follow my lead. So let your shoulders just kind of hang at your sides and your eyes closed. So I want you to imagine yourself coping with this stress, doing well. You're on top of your game. You've got it. You're handling it excellently well. Or you can imagine yourself in a safe place, safe in the awesome hands of God, or safe in the hands of the one you love. It can even be a destination. It could be in your closet, beachside, a cozy hotel off in Switzerland or the south of France. So when you have this vision in your mind, just hold it there, because we will call it to mind in a bit. But for now, your eyes are closed and you are relaxed. So I want you to begin to inhale. 1, 2, 3, 4. Now hold your breath. 1, 2, 3, 4, 5, 6, and 7. Now exhale through your mouth or through your nostrils, whichever one is comfortable, and tell yourself relax. And now bring up that image I told you about and imagine yourself there, relaxed. So you can all open your eyes now. So you can do this multiple times. Do you know that this is even evidence-based to bring down your blood pressure? It works. I've had patients who were anxious, white coat hypertension, and they came to my clinic, did a blood pressure 160/90, and I walked them through this, and we were at 120/80. It's not magic. What it does is to stimulate your vagus nerve, which is the nerve that helps us relax, and you relax. So let's imagine you have to give a presentation and you feel like you can't meet up. You can do this before you are called up. So we just finished deep breathing and visualization. Do we have any questions before we move on to the next technique? Is there anything you've done? I'm hoping you followed my voice that you don't understand or you want to be clearer about. No? Okay. Mindfulness, lovely, very helpful technique. So before we practice this, it's important we have an understanding of the theory of it. A lot of people think mindfulness, they think East Asian, religious, meditation. No. This is evidence-based way to deal with worry. So what is worry? Worry is a string of thoughts or pictures in your mind that causes anxiety. And they tend to start from one key source and they keep going in different directions. Different thoughts, different statements. If you think in thoughts, yes. If you think in pictures, imagine the same thing. So it comes from one scenario and it keeps going into different scenarios. And the telltale thing about them all is that it's catastrophic. It ends in a catastrophic way. Either you die or everybody dies or you lose your job or you're fired spectacularly. So that is worry. So for the person I asked about what am I going to be doing is, am I not, when I talk about compartmentalization, am I not trying to run away from the stress? So there are two types of worry, interestingly, productive and unproductive. So productive is when the thing that is the worrisome thought, you have control over it. You have influence over it. You can change it. There's something you can do about it. So let's assume it's work, because that is what this topic is all about. Your job. So you don't like, your boss. Your boss is, demeaning and all that. or your colleague, your co-workers. So the question to ask yourself is there anything you can actually do about it? Can you speak to the head of the department about it? Can you request for some kind of intra-departmental transfer from one team to the other? Is there something you can do? Is there someone you could influence to get things to go your way? Is it within your control at all? If those thoughts, you answer yes to those questions, then that kind of worry is a productive kind of worry. But we all know that there are the types that are unproductive. So in answer to your question, if it's a productive worry, you problem solve, look for solution, brainstorm all the possible options, look for the advantages and disadvantages of each option, and pick the option that has the highest advantages and the least disadvantages, and implement. And then if you implement it, it doesn't work out, implement the next one. But if the worry is unproductive, meaning it is beyond your control, there is nothing you can do. For instance, a worry of, what if this ceiling falls down while we're all here? What if I suddenly drop dead? What if a fire breaks out right here and now? What if a lion escapes from the zoo and, So unproductive worries typically start with what ifs. And the characteristic of them is there's nothing you can do. What if my husband leaves me? There's something you can do depending on your behaviors, but I think you get the point. When there's nothing you can do, you can't influence, you can't control, it's not within your power to do anything. And it's usually about something, I'm talking about unproductive worry now, and it's about something in the future or in the past. You cannot change the past. You can only change what it means to you and about you. But the actual thing that happened cannot be manipulated anymore. What we can manipulate as therapists is how you feel about it, what you conclude about it, what it means to you. So we're talking about worry, the types, productive and unproductive. The reason why we're having this discussion is because of mindfulness. Mindfulness means disengaging from unproductive worry, because you can't do anything about it. It increases anxiety, it increases stress. And we're talking about work-related stress. So the practice of mindfulness is one way of dealing with work-related stress, especially when there's nothing you can do about it. If there's something you can do about it, by all means, go ahead and do the planning, the preparation, or the problem-solving. But if it falls under unproductive, then this is what you need to do, what we're about to learn, mindfulness. So the principles of it. Mindfulness works on certain principles, and that is that negative thoughts, that is the unproductive thoughts, unproductive worry thoughts, will surely happen. So I'm sure most of us have tried to deal with this unproductive worry by ourselves. We try to replace it with productive, something good. We bring up helpful thoughts. We banish the negative ones. We criticize ourselves. Don't think like that. God forbid. Think positive. You force the positive picture. Do you know what happens when you do that? The unproductive worry keeps staying there, because the more energy and effort you put into suppressing a thought, the more likely it is to come back up. The more meaningful it is, the more energy you put. So mindfulness is another way to do this. We're still disengaging from unproductive worry, but not just in the way that most of us are already doing. So the first principle is accept it. That you think negative things that are not helpful or unproductive, it's what the mind does. The mind produces thoughts. Just the way you cannot scold your ear for hearing. You cannot scold your body temperature for feeling cold in a cold environment. The mind will produce thoughts. Whether you engage in it and follow it through is a decision, or you disengage with it and focus on something else. So the first principle is acceptance. The second is focus. Okay, I think it's not showing very well, but it means non-judgmental refocus of your attention from the unproductive worry to what it feels like to breathe. So that's why it's called mindfulness of breathing. There are mindfulness of different things, but the one we're learning today is of breathing. Any questions so far before we go into the practice? Any questions on mindfulness of breathing, unproductive worry, productive worry, disengaging principles? No questions? Okay. So we're going to practice this. So again, get comfortable. To be helpful if your eyes are closed. There's another type of mindfulness that you don't do with eyes closed. So in case you're wondering, so if I'm stressed at work, am I going to close my eyes? No, there's another type. Or if I'm driving, will I close my eyes? No, there's another type. But for purposes of this presentation, this is the type that I'm going to be allowed to teach because of time. So get comfortable, close your eyes. Jump to the next technique, which is communication in the workplace. So we'll get back to the mindfulness as soon as we're set with our logistics. So another skill I want us to learn and maybe even break up into groups and practice is communication in the workplace. So you probably know already that there are difficult patients. There are patients who are demanding and entitled, and they want what they want because they are paying so much money and they want you to do things the way they want you to do it. So communication is huge for nurses and healthcare practitioners. You need to be able to communicate effectively. So it's also a point or a source of stress. And so we're going to be talking briefly about types of communication, how to listen and how to speak, especially when you're trying to negotiate. So this is not interpersonal conversations like husband and wife, this is workplace conversation. So there are three types of communication: the oral, the written, and the nonverbal. Interestingly, the nonverbal communication makes up more than 70% of the types. So we medical people, nurses especially, you need to be careful about your body language, your posturing, because it can say words. It's, there's this saying that, your behavior speaks so loud I can't hear what you're saying. So it means that your body language is in complete opposition to what you're saying. And human beings, patients, our patients, they read this. So if you learn what we're talking about, you can learn to appear a certain way when you don't necessarily feel that way. So oral, written, and verbal, non-verbal. So communication, basically two phases. You're either listening or you're speaking. So when you're listening, it's not a passive thing where you're just keeping quiet. It's that time when you're paying attention to what your body language is saying. So let me throw some light. For instance, if you come into a patient's room, for your rounds, and you want to dispense medications, and you come in and let's say you had a quarrel with your subordinate or your supervisor before you came in. So you come in and your arms are across your chest and you're not particularly very happy and your stance is a certain way. And so that body language, irrespective of what may have caused it, is going to rub off on what the patient feels about you. Because remember, as you are watching the patient is watching you. So if you want to have the best chance of success and you are aware of the way your body appears, regardless of whether your supervisor or your subordinate made you angry, you will know not to do like this, you know to do like that, or to stand like this, whatever is more but not like this. And you know to put a smile on your face and say good morning or good afternoon and how was your day, regardless of what is boiling in your heart. So if you're sitting down as well, when you're relaxed and leaning on your chair and looking at your wristwatch every 5 minutes, you give the impression that that patient sitting in front of you is not important, and you'd rather you have some place more important to be and some people to talk to. But when you sit up in your chair and you're leaning slightly forward and you're looking at the patient, even if your mind is on someplace else, it appears to the patient that, oh, my nurse is awesome. She's on top of things. She knows what she's doing. And then, the same thing. When you're, dispensing your medications, remember these are patients. So they are not happy, they are moody, but you are the professionals, and you are the ones who have this information about body language, and you know how to present yourself. So that is, by the way, about body language. So I was talking about listening. So listening is not just to keep quiet. It is to convey by your body language that I understand what you are saying. I am with you. I am following. So you do that by nodding, and then when there's a time, when there's a lapse or a pause, to paraphrase. Paraphrase just means saying in your own words what whoever was talking said. And then you inquire to clarify. So I like us to please pay attention because the next, guess what, is practice. So we're going to be practicing. So that's about listening. Then speaking. So you want to say something, and especially when you want to disagree with what you just heard, or you want to negotiate, you want higher pay, you want something that you sense the person you're talking to might not necessarily be open to giving you. The first thing to do is identify something the other person has said presently or sometime that you agree with. And I know it's not easy when you generally don't agree with this person, but look for something, look for a grain of truth that you agree with and say it. And if there's a criticism that has been laid on you in the past, this is the time to own up if it is true and you agree. Why? Why would I start off with this? Because it's called disarming. So when you do that, the person is like, oh, okay. The person relaxes and is now listening to you. Because remember, the person also is involved in this relationship and knows that this person wants to ask me for something. So they are also on the offensive. They are on the alert as well. So if you move in with your pitch, you might not succeed. But when you start off with saying, oh, thank you, I learned a lot from the talk you gave, and I agree that maybe sometimes I might not have done my job to the best of my ability. I take responsibility, and I will do my best to do better. The person's like, now you're talking. Now they're listening to you. Now you can say what you really want to say. And you can also adjust this in interpersonal relationships, husbands and wife. So quick hint. So before you make your pitch and say what you want, mention something that person has done that you admire and you are grateful for. Oh, my husband, I know you provide for this family. You are such a good provider. We appreciate it, even though we don't always say it. And it's like, yeah. Don't I? I know I do, don't I? And the person is ready for you to say what you want to say. You have successfully disarmed, and they are now listening to you. Their guard is down, and they're now ready to hear you. So the next step is to express your point. Remember, we're talking back to workplace. We're talking about negotiation. You want something, and you're thinking that you might not get it. So express your point, starting with I. Anytime you use you, it comes off as accusation. It comes off like you are aggressive. So you want to pitch it, you want to phrase it in such a way that it starts with I. So I feel like in this team, the general vibe or the general impression is that people are not really comfortable. People feel like they're not being heard, they're not being validated. Remember, we started with our disarming. So then you say, my opinion is that, or I feel like despite everything management has done to make DMC a wonderful place to work, there are still some people that are feeling, unsatisfied with the way things are. And the third point is point out how your point, or outline how your point of view is beneficial to the other person. So you know why you want what you want, because of some benefit that you will get. But how is the other person going to benefit from this? So you start off your point by emphasizing the benefits the person will gain from this thing that you're going to do. So I'd like to suggest that work resumes by 10 a.m. rather than 8 a.m. This is hypothetical. Because people are so stressed up at home, and when they come by 10 a.m., they are more likely to come on time. They are more likely to be focused to work because they would have had sufficient time to sort out their businesses. And we're more likely to achieve our focus, because our goals, because we're more motivated, because we realize that DMC has given us a lot of leeway, a lot of mileage. That's just an example. So whatever it is you want to phrase it from the point of view of what will that person benefit, because they are in it for the profit, mind you. It's a workplace. And keep your own benefit to yourself. They probably know already. Any questions before we go to the practice? Okay, it's clear. So for the practice, I'd like us to break up into 4 major groups. I don't know who can help us with that, or we can just organize ourselves. And then each group appoints like 2 representatives, and then I'll paint a scenario that you'd use to practice what I've just said. Once we're done with this, we'll go back to the mindfulness. So we've not skipped that. I just didn't want to waste time while they were sorting out the logistics. So please let us have ourselves shared into 4 major groups. And each group should have appoint 2 representatives. So the scenario is this. You're nursing an entitled, demanding patient who refuses the prescribed medications you want to administer and is insisting you give her the one she prefers, which she read about online and believes is superior to the one you're about to administer. So the 2 people, one will be the speaker, and then the other will be the listener. So the speaker is the nurse, and the listener is the patient. We'll play the role of the listener and the nurse and the patient. So I'm going to give us about 10 minutes to do that, and then we'll take it from there.
Good afternoon, everybody. We're going to have 4 groups, like Dr. Chika said. So this serves as one group. The 2 tables serves as one group. The 2 tables serves as one group. This serves as another group, and this other place serves. So the people at the back, please come forward and join the group in front of you. Did you hear what I said? We have, this serves as a group, this serves as a group, these other 2 tables serves as a group, and the last one serves as a group. You said? What do you want? I want us to mix properly. Please. DMC knows, I want us to be very integrated with our colleagues. So please, let's move forward. Just take your role and integrate with the nurses in front of you. Come forward with your seats. So this is a group. So this serves as a group. Yes, so these 6 tables makes up one group. So this is a group, ma'am. Yes, ma'am. Okay. Yeah. So this is group 1. This is group 1. This is group 2. Okay, don't worry. You don't need to mix. This becomes group 3 and this becomes group 4. Just stay where you are. Eh? Okay. Do we all know our groups? So this is group 1, group 2, group 3, and group 4. The number 1 task is each group will appoint 2 people, the leader and the presenter. Appoint amongst yourselves quickly. Group 1, your leader and your presenter. Anybody can do it.
So what we're basically trying to reenact.
Okay, and the presenter? Okay, thank you.
We're trying to practice what we've been talking about, the communication skills. So it's basically like a role play.
Yes. So I was corrected. It's a patient and a nurse. Okay, so who is the patient for group one and who is the nurse for group one? Yes. Ma, you're the patient. And who is the nurse? Okay, sir, you're the nurse, and Ma, you're the patient. Thank you so much. Group two, the patient and the nurse. Sir, you're the patient and the nurse. Thank you, Ma. Group three, are we ready? Who is the nurse and who is the patient? You're the nurse and the patient. Thank you. Group four, are we ready? Who is the nurse and who is the patient? Okay. Thank you. Thank you so much. Tax 2. Tax 2. So we are supposed to carry out this scenario that is being projected on the screen. For the patients and the nurses of the various groups, please listen attentively. You are nursing an entitled, demanding patient who refuses the prescribed medications you want to administer and is insisting you give her the one she prefers. She has read about this new medication online and believes it is superior to the one you are about to administer. The speaker is the nurse. The listener is the patient. For all the groups, the nurse should convince the patient to take this medication. Yeah, using the listening skills that Dr. Chika listed out to us. For 10 minutes, please. See, can we get a video coverage of what they're doing? Group 4.
Tell them 5 more minutes so that they can begin to round up.
3 minutes more. Time to cross your T's and dot your I's. Thank you, everybody. Thank you. Thank you for that wonderful exercise. Our time is up. Don't talk again. If you talk, it's exam malpractice. So the representatives of each group will be coming out now. We'll be starting with group 1.
Hello? Okay. Go on.
The nurse and the patient of each group. We'll start with group 1.
So while they are coming to do the role play, can I have our attention, please? Can I have our attention, please?
One house, please.
So while they are coming to do the role play, I want the rest of us to be their examiners. We all know what good communication should be like, so we should be scoring them. So at the end of the day, you've been given a sheet of paper. So I want you to score them over 5. 5 is excellent. As 5 over 5 is excellent, 4 over 5 is very good, 3 over 5 is satisfactory, 2 poor, 1 fail. So score the nurse, score the patient over 5. Because at the end of the day, we'll now want to know which group embodied all that we've learned today about communication. So let me have the first group, please. Representatives from the first group.
Group 1.
Group 1.
A round of applause for group 1 representatives. So the patient stays here and the nurse stays here. The members of the jury, please, we'll keep an eye on them.
Sorry, good afternoon, professional colleagues. We are here for a role play, and you follow us the way. Good afternoon, Madam Keshi.
Good afternoon.
I'm Nurse Akinola Julius.
I'm Okwade Adeshola.
I've come to serve your medications.
Okay.
It's time for medication. And the drug I want to give you is diclofenac. Because yesterday you asked me that I should tell you the name of the drug I want to give you. It's time for me to serve the medications, and I want to give you diclofenac.
Okay, diclofenac?
Yes.
Are you giving me injections, or you are giving me tablets, or suppository?
No, I want to give you suppository.
Suppository, why? I think I prefer tablets. I can't take suppository.
Hello, ma.
I've read a lot. Sorry, please. I'm your patient.
Yes.
I have every right to tell you what I want.
Sorry, Mrs. Nkechi. The reason why I prefer to give you suppository, you know you are an ulcer patient, and if you take oral diclofenac, there's possibility that the diclofenac will, because of the interactions, it tries to erode the mucosal lining of the stomach, and it causes more harms to you. But when you take suppository, it's very effective, it's very efficient, it works faster, and it relieves that pain without any stress.
I'm disagreeing. The reason why is I have been on the diclofenac injection. I took it in between my meal. It's very easy for me to take. It's less painful. I don't feel pains at all when I take it. So I don't think I'm agree with you.
Sorry, Mrs. Keshi, I could prefer you take the suppository because it's more efficient than the oral diclofenac you are talking about.
Okay, Mr. Julius, you are a man.
Yes.
How will you insert me suppository?
I'm a nurse, and I'm trained to serve medications, whether suppository, whether injections or oral. It is my duty to attend to my patient and to make sure that you get well quickly.
Then I need a female nurse to attend to me. You can't insert suppository.
Madam Nkechi, please, I'm a nurse. I'm a trained nurse and a qualified nurse. I think I should be in better position
then
to do
I
this.
should open my bonbon for you?
Madam Nkechi, in situation like this, there's nothing you can do because I'm the only person on duty. And for me, and you know your condition is very important.
Can I have the gloves and the medication? Can I insert it by myself? I can do it.
You can't do it.
I've read a lot on it.
I know you have read a lot.
Mr. Man, I can't do it. Can I have the gloves?
Okay.
Can I have the injection? Can I have everything? I can't do it.
You want to do it by yourself?
Please, can I have the directors of this hospital in this place?
There's no problem.
I can't do it. Let me have the gloves.
The reason why you can't do it is because if there's any side effect, I will be held responsible. And I'm the one that is supervising you.
And I said,
thank you,
I'm your
thank
patient.
you,
I have
thank
every
you,
right.
thank you to group one.
Thank you
to group one. Okay, the nurse and the patient for group 2. Can we have you come up? Thank you so much for that wonderful role play. Thank you so much. A round of applause for them again. I hope you people scored them. Okay. A round of applause for group 2, the patient and the nurse.
Please remember that the scoring is according to what we've learned. So you want to know whether they are using the skills that we just talked about.
Thank you, Dr. Chika. Who is this? Your time starts now, ma.
Good afternoon, Mr. Musa. How are you?
I'm fine, ma'am.
Hope you are getting better.
Yes, I feel a little bit better now.
Thank God for that.
Yes, ma'am.
I am here to serve your medication.
Okay.
I've just checked your blood pressure, and I see that it is very, very high. It's a bit high, but it can be controlled. You know you have been taking your antihypertensive. So now I want to serve you your oral medications now, okay?
Okay.
And the tablet I want to serve you now is Aldoment tablets.
But I just read online now about one particular drug, that's Labitelol. It works faster, so I think that one will be much more better than the Aldomet you are talking about.
Wow, Mr. Musa, I'm so impressed that you are a very, very learned person and you are concerned about your health. But I think this argument is better for you because of your blood pressure, and already you have been placed on that medication.
Okay, but why did they say online that labetalol tend to be better to bring down blood pressure?
Don't follow this online, okay?
Okay.
I want you to understand that labetalol will just crash your blood pressure, and it has a lot of side effects.
Okay.
It has a lot of side effects, so it's better for you to go on the one, and I'm going to serve you now.
Okay. It's all right.
Have you eaten?
Yeah, I've eaten.
You have eaten, but what did you eat?
I took a wedu soup with amala.
As soon as I serve you this medication, by the grace of God, you will start resting well, okay? And you will sleep well, okay?
Okay.
Don't worry about anything.
Okay.
It's treatable, it's manageable.
So you are very sure that the abdomen will bring down the blood pressure?
Yes, it's very, very safe.
It's okay.
You don't have any problem.
It's okay.
Okay?
It's okay.
Thank
Thank you.
Time
so
up.
much.
Thank you. Thank you so much, Group 2, for that wonderful role play. Group 3, are we ready? Are we ready? Okay. Give us the most stubborn patient and the most pragmatic nurse. Group 3. Welcome. Your time starts now.
Oh, good morning, Miss Nora. How are you doing today?
Good morning.
Yeah, how are you doing today? Hope you slept well.
Does it matter?
Okay. Nurse Kenechukwu. I've come to see how you are doing and serve your medication today. I understand that from the various blood pressures taken that you are hypertensive, and they have prescribed an antihypertensive for you, amlodipine, and I've come to serve the medication to you.
Sorry, what did you just say?
I said that I came to serve your medication from your various blood pressures taken. We understand you're hypertensive, and the doctor prescribed this amlodipine tablet for you, so I've come to serve you the medication.
I'm not hypertensive. My pastor prayed for me and said I'm fine.
Your pastor prayed for you, if I understand. Has the high blood pressure been able to be down since the pastor prayed for you?
I think I'll be fine after 3 sessions of prayer.
Oh, after these prayer sessions. Okay, in that case, we have to recheck your blood pressure again before I serve you the medication, so that we'll actually see if the prayer is having more effects on your blood pressure, or do we still go ahead to serve you this?
Okay.
All right. This is the medication, is amlodipine, is 10 milligram, and you take it just once a day.
What brand is this?
Is Bicham, and you can see that there is from
Sorry,
the
just
packet
give me
I
a
got
moment.
it
Let me
from.
quickly check it out on the internet. Did you say, what did you call it?
Okay, you want to check on the internet?
Yes.
Let me just give you some times to do that.
Bicham is one of those cheap antihypertensives in the market. There is this one I used to use, Novak. I got it from the US the last time. It's just that I ran out. I would have come with it. So can I get that particular brand, please?
Sorry, we don't have that one now, but this one is very good. And from the packet, we got this one. There's a scratch here. When you scratch it and send it to a particular code that is written there, you find out if
all
it
these
is yes.
scratches on
Yes.
medications. So how am I sure?
No, but it's a trusted drug company.
Okay then. Can you scratch it for me, please?
Yes,
You know,
can.
I just fixed my nail and I don't want anything to affect it.
Okay, let's put it on the phone. 323. Yes, they'll give you an answer.
Oh, it's rated 5-star. Oh, thank you very much, Nose, for convincing me. You're such a nice person.
Yeah,
Thank you for your
Thank you.
patience.
Thank you
right.
so much. Thank you
Yes,
so
there's water
much.
to drink your
Thank you so
medication.
much.
Yes. Thank you.
Group 3, this people's patient has attitude, though. She has attitude, though. Okay, group 4, the nurse and the patient.
Knock, knock.
Yes, you can come in.
Good morning, ma'am.
Morning, how are you?
I'm fine. I'm Nurse Linda. I'm your nurse for the day. How are you doing?
Well, I'm good.
How was your night?
Fine.
Okay. Ma'am, I'm here to serve you your morning medication.
Morning medication? What
Yes,
type of
ma'am.
medication?
It's antibiotics, Fleming.
Okay, Flaming. But I can see you're holding a tablet.
Yes, ma'am.
Is it tablet you're giving me?
No, ma'am. Actually, the IV medication that you've been taking, they converted it to oral because of constant line tissue, problem of starting a new line, and you might develop phlebitis from the line side. So they decided to convert it to oral since you've taken like 5 doses of the IV medications.
You know, I hate taking oral medications. More especially this one, the way I'm seeing it is, it tastes bitter. Even without me swallowing, I know it will taste bitter. So I prefer my IV. Just get me my IV. And I even Googled through the net that IV drugs, as you give, it start to work. Any bacteria, it will just kata it at once. And now, you're giving me oral. I don't think, I'm not ready for any oral. Just give me my IV.
All right, ma'am. I understand your worries and the one you want, but actually, like I explained before, they started you on the IV because of the high white blood cells and changed it to oral because of the constant line tissue, and you might develop some people, like you have been complaining that the site where they started the line has been paining you. So the doctor decided to change it to oral since you have gotten at least a required dose of the IV medication. You've taken up to 5 days. So for this, I understand that your complaint is bitter, but I will require you to take it with enough water. And believe you me, this one is just like a maintenance though. It's same thing with the IV, just that the IV work faster, but this one will complete the work that the IV have started.
Okay, then well, definitely I've been complaining of pain around the cannula side. Well, let me see, since you said it's not bitter, okay then, I will go ahead to take it.
Thank you, ma'am.
Okay then.
Thank you, thank you, thank you so much. Thank you so much. I know from this presentation, there are patients we don't want to encounter, true or false. I don't just want to call the groups, but we know them. Please, we'll go around and collect the results now. No, you have to score your group too. Score your group. So each group should give us 4 results. Each group should give us 4 results. No, it's over 5. Group 3. Okay, so for each group, you score 5 points for the patient and 5 points for the nurse.
And speaking skills. That's what you're scoring. 5 is excellent. 4 is very good. 3 is
Group
fair.
2.
2 is poor. 1 is bad.
Upload your results at the IREF portal, please. No rigging, no rigging. The beavers has to work, oh. For the sake of this presentation, the beavers has to work. Smooth transmission. No break in transmission. All right, thank you, ma'am. Thank you, everybody, for your active participation. A round of applause for ourselves, please. So we'll continue. Go back to your previous sitting positions. We'll continue with our audio, and the results will be announced later.
Thank you all for your active participation. The aim of that exercise was to put into practice what we're talking about. It's not so easy to do. It's very easy for me to say it and for us to understand, but putting into practice is not so easy. I'm hoping that we'll all, imbibe all these things and go back to our various places of work and put it into practice. You will attest that it achieves, great results. It's a soft skill, yes, but it carries over into, reaps excellent dividends for both you as a nurse and for your organization, the place of work. So we're going to go back to mindfulness. I'm going to go through what I said, in case we may have forgotten what I said. Then we'll go through to listening to the audio that we're trying to sort out before we went to the communication. So mindfulness of breathing is a way to disengage from unproductive worry. Unproductive worry is when you have thoughts in your mind, worrisome thoughts that you cannot, about something you cannot do anything about. Something that is not under your control, is not under your influence, is something that happened in the past, or something that is going to happen that you fear might happen in the future. So remember we said for productive worry, that's something you have control over. It's something you have influence over, something you can either plan, prepare, or problem solve about. The non-productive worry is not amenable to any of these because it has either already happened or it hasn't even happened. Unproductive worry typically starts with what ifs. So mindfulness is a way that is evidence-based to help you detach yourself from this worry that is going on in your mind. Because if you keep following the worry to its logical, catastrophic end, what will happen is anxiety will increase, stress will increase, and all the symptoms and consequences that we talked about earlier might play out. So to disengage from all this and avoid all these things, that's where mindfulness comes in. So 2 principles. Firstly, not to judge yourself, blame yourself, criticize yourself for thinking these kind of, unnecessary, quote-unquote, thoughts. So accept that your mind will produce unhelpful, unproductive worry thoughts. That's what the mind does. Just the way you cannot blame your ear for hearing. And then the second principle is when your mind, so we're going to have you focus, redirect or rechannel your mind or your thoughts from the worry to your breathing. And whenever your mind wanders back to the worry, just gently focus it back on what it feels like to breathe. So if you understand this, we'll now play the audio. Is there any question about this theory before we go on? Is there anyone that's not clear what I mean when I say disengage? Disengage means refocus your mind from those thoughts or those images that are worrisome to the sensation of breathing. And the audio I will play will guide us into how to do that. Typically with your eyes closed. So this is a type of mindfulness. So to be mindful just means to be aware of the present, what is going on presently. There are different types. Some other types are mindfulness to focus attention, which you can do with your eyes open. But for the purposes of this presentation, I'll focus on this one, breathing. So if we have no questions, we'll go straight to listening to the audio. So I want you to please follow the prompts. If you want to learn or practice this properly, just follow the prompts. Usually what will happen is when you follow the prompts, it will guide you to remove your mind from whatever worrisome ideas you have, whatever worrisome pictures you have, to what it feels like to breathe. And it will keep prompting you. If your mind strays, bring it back. So just follow the prompt so that subsequently, if you ever encounter unproductive worry, you can actually do this by yourself. If you want, you can add the visualization later, but for the purposes of this presentation, just follow the prompt. So can we sit comfortably, relax, and close our eyes? Comfortable, close your eyes and follow the prompt.
5-minute mindful breathing. Sit or lie down. Make yourself comfortable. Take a few moments to be still in your body. Allow yourself to become aware of where your mind is at just now. Take a moment to notice your thoughts. Gently close your eyes or softly gaze ahead, finding a point of focus that is not distracting. Gently bring your awareness to your breath. Start by taking 2 full breaths. Now, allow the breath to settle and find its natural rhythm. Notice where you feel the breath most clearly. This may be at your nostrils, upper lip, neck, throat, chest, belly, or somewhere else. When your mind pulls you away or distracts you during this practice, you can come back to this part of your breath as an anchor or point of focus. Breathe in naturally without controlling it. Allow your body to breathe for you. As you breathe in, be aware of breathing in. As you breathe out, be aware of breathing out. Keep your awareness on your breath as you breathe in and breathe out. In this practice, there is no need to visualize your breath, count, or slow down your breath. Just be open and aware of breathing in and breathing out. Without judging your breath or changing your breath, just watch it go in and out, like the ebb and flow of a gentle wave at the shore. In and out. If your breathing changes, that's fine. It does this naturally. Don't push it in any way. Just observe. There is nowhere else you need to be right now. Nothing you need to do. Just be here now, simply noticing your breath, living in this moment, one breath at a time. When your attention drifts away from your breath, simply take note of where your mind went, and then gently bring your attention back to your breath. Ride the gentle wave of each breath, moment by moment, breathing in and breathing out. Continue being aware of breathing, noticing the point of focus of your breath without changing your breath in any way. Watch it come in and watch it go out. This breath. This breath. This breath. As you reach the end of this practice, congratulate yourself for taking this time to be present with your breath.
Okay, please open your eyes. So I'd like two people from each side, so one from this side and one from this side, so please come and give me your experience of that exercise and be honest. How did it feel for you to do that? So anyone who wants to give me feedback can raise your hands and I'll give you the mic. So let me know how it felt and whether you felt relaxed, whether you didn't feel relaxed, whether it was difficult, what were the challenges. All right, please come up.
Sorry, I'm smiling. This one is quite better than the previous one. It's relaxing, it's soothing. You know, it kind of calmed my nerve. I was almost sleeping off, something like that.
I know you followed it because I did this for a patient in my clinic and I had to tap her and say, Madam, we're doing an exercise. Yes, yes, yes. So yes, it will induce sleep. So it's perfect for nighttime when worry is keeping you awake. It helps to induce sleep. One person from this side, please. No one? No one? Okay, woman. Thank you.
Thank you. What happened is that when I shut my eyes, it just made me not to be aware of the surroundings or the things that were going around the surroundings. So I was just focusing on, breathing. I was following my breath. I was following the prompting of the man. He was saying, breathe in, breathe out. Say you follow your breath. Honestly, at a time, I didn't remember where we are.
Thank you for the honest feedback. So remember, the point of this exercise is to watch your thoughts without engaging. So the reason they use the breath is because we all breathe. If you're alive, you will breathe. So it is, maybe we all here might not be the perfect candidate to practice this on, but the perfect candidate is someone who is worried about something they can't do anything about. Maybe if I want to leave the country, I want to leave, or my marriage situation or my work situation, and you've tried and it's not working. So that's when you understand how powerful this is. So what it's basically teaching is you don't have to follow every thought to its logical conclusion. You can stand like an observer and watch, and when you are tired, you can refocus your mind on your breath. So the analogies I like to use is like the one of leaves by the stream. That's why I have this picture. So imagine your thoughts are like these leaves. You don't like them. Are you going to jump into the river and begin to pick them or throw them the other way if they are flowing downstream? What mindfulness is teaching is you don't have to do anything. You can sit back, watch the leaves going down, and refocus your mind on something else. So refocusing that mind in this analogy might be getting up and walking away. Another analogy is like watching TV. So imagine that the channels on the TV are your worrisome thoughts, the things that bother you, and you can't do anything about it. So will you rush to the station and begin to say, stop playing, maybe they're playing something you don't like, boxing or fighting, or you're seeing blood, shooting and young people dying. Will you rush to the station and say, don't play this? Or will you break your TV and why would my TV play this? You could actually just change the channel, refocus your mind, put off the TV, refocus your mind. So that is the teaching of mindfulness. Refocus your mind from worrisome thoughts you can't do anything about and put your mind on what it feels like to breathe. So if you took anything away, take this away. And you can prompt yourself. The prompting is just to give you an idea of how it works. So in practice, what I do is to do one with the patient where I'm the one giving the prompting. We record it because then I'm using worries the patient came to see me for. And there's nothing me or the patient can do about it. So we use this. So I record the one we're doing, and then I send it and say, listen to it. And then as the worries change and the person gets more matured and conversant with the skills, their own mindfulness practice change. So it's huge and helpful, something that you can do in the night when worry is keeping you awake. So let's move on. We just finished our communication, so our results are in. So I'll start with the group with the lowest score. And that was group 1. So overwhelming majority felt that you scored 15%. And the nurse was given 12. That's over what? 12 over 20. And the patient was given 18. So people felt the patient played the role of a listener better than the nurse played the role of speaker. So what we're judging is the ability to follow these speaking skills that we talked about. For instance, when the nurse or the patient said, I read online about labetalol, I think that was group 2. And the nurse said, oh, I'm impressed. So that is her identifying what the patient has said and, agreeing with it. Oh, labetalol. Yeah, it's helpful and I'm impressed that you did that. So already you've put the patient at ease. I said it, I did well. Then she comes and says, however, she brings her own point across. And at the end of the day, she's saying, but this is beneficial. And she mentioned some things, how it will be beneficial. So what we're marking is not the acting skills. What we're marking is ability to follow this communication tips. Then the next group is group 2. Group 2, the nurse was scored 17 over 20, and the patient was given a 14.5. So we have group 3 and group 4 vying for the top position. So the winner is group 3. Congratulations to group 3. Which one is group 3, please? Is it? Yes. I enjoyed you people as well. So well done. And we wish we had a prize, organizing committee, but it's okay. I think the prize is we all learning to imbibe the communication skills. And every group, thank you so much. You did well. It's just that somebody has to win and somebody has to be last. All right. So we have, yes. So I'm going to conclude with this now. So we're talking about how to handle work-related stress. So I want to stress that. Did you see what I said just now? I want to stress that stress. I want to emphasize that stress is universal. Everyone feels stress, even children, young people, elderly, retired, working. But today we are recognizing Nursing Week, and we're talking about work-related stress as it applies to nurses. So stress can be acute, it could be chronic. The acute one is the one that is short-term, less than 3 months. And it's the stress you feel at that time. It's physiological. It's your body's attempt to handle what you're going through. The chronic one is the one that causes the problems, the consequences with individuals, workplace, and even your family. It even reduces your immunity and increases your risk of having pre-existing problems resurface or even having new ones, ulcers, headaches, not being able to concentrate. We talked about the skills that we could use, techniques that we could use to help us handle stress. We talked about being able to have a life-work balance. We talked about exercise, living a healthy lifestyle, diet, sleep, exercise. And then finally, we were talking about communication, and we learned breathing technique, 4-7-8 technique, which is useful when you clearly need to induce the relaxation response. You don't have time to do a mindfulness of 5 or 10 minutes. You need to be relaxed. You can do the 4-7-8. You can couple it with visualization. You can visualize yourself coping. You can visualize yourself in a safe place. And then we just finished the communication skills. Thank you so much.